My mother was not asked about her family health history, nor was she offered genetic testing. Now,
Mm.
mind you, that was 2003. So the conversation is not as mainstream as it is today, but it was available, right? And she should have been talked to. We know that there's disparities in the communication of genetic testing from provider to patient, especially in Black women, right?
In that instance, bracket testing had been out for about 7 years at that time. But in this instance, the provider didn't, as you mentioned, didn't even ask for your mother's family history. That sounds pretty basic. This is stuff that you fill out on your paper when your intake paper to try to put in your chart. Okay, it's one thing for it to
Mhm.
be in the chart. It's another thing for somebody to act on it.
I think another thing is also understanding not only with healthcare access, it's understanding how to be able how to navigate our health care. I know when I was going through my medical management and even my double mastectomy, I had to be an advocate to my health insurance. There were things that they did not know, so I had to equip myself with the policies in the legislation.
That is
Um,
huge. That
it
is
is.
so huge.
This is Genetics for Healthcare, a podcast for patients.
Thank you for tuning in to another episode of Genetics for Healthcare, podcast dedicated to helping patients and their caregivers advocate for a precision medicine approach to their care, which includes treatment, disease screening, and prevention. You can find us on Spotify, Apple Podcasts, YouTube, LinkedIn, Facebook, and even TikTok, wherever you find listen to your podcast. And also, you can join our community of listeners at geneticsforhealthcare.com. Look for that subscribe button. Today, it's an honor for me to have Ashley Dedmon, BRCA2 carrier and cancer previvor. We're going to get into that. Ashley, thank you so much for being a guest on our podcast and coming in and sharing the advocacy work that you do.
Thank you, Rome, for having me. I'm super excited for today's discussion. I've been listening to your podcast, and really a congratulations to you on launching your podcast and being able to have these conversations. I think the most recent one I listened to was the one with Kathy Baker, a good friend of mine. And so thank you for having me.
Absolutely. Kathy Baker is awesome. And the community of patient advocates, those people that I follow online, whether it's Instagram or LinkedIn, inspire me and encourage me to continue to do this work on a bigger level and to just to think bigger about this. And on that note, I want to get into your backstory of kind of like how did you get here, right? Tell us about your story as a teenager being a caregiver for parents diagnosed with cancer.
Yeah, so my origin story, as you said, I was a teen caregiver of two parents with cancer. My mother was diagnosed when I was a junior, just going into my senior year of high school with metastatic or stage 4 breast cancer. And during her experience or her journey with cancer, she was with her treatment options. She underwent hormone therapy, chemo, radiation. She even had the opportunity to undergo a clinical trial. And unfortunately, we know that while there have been many advancements since 2003 with metastatic breast cancer, we know that there currently still no cure for this disease. And so, after 4 years, she did pass away. And shortly after, my father was diagnosed with prostate cancer. In Rome, it was very devastating as a young teenager, then transitioning into early adulthood to have two parents who were diagnosed with cancer. I remember my father being just an amazing caregiver for my mother. My dad was her primary caregiver. I was her secondary caregiver. I was still in college, and so I had received a volleyball scholarship that eventually I let go so that I could
Mhm.
spend what extra time I did have in college with my mother, helping to support her. My dad was a high school football coach, so you know how that can be on Fridays, Saturdays, Sundays. He was working, and so he could really focus on work on the weekends because at one point he was the primary caregiver because my mother had to stop working. I wanted to be able to come home and care for her. And so that's really where my journey as a caregiver began. And then after my mother passed away with my father's diagnosis, I had learned so much from my mother and just the open and ongoing conversations that they had had with me. I stepped right into the role of caring for my father, who was diagnosed with prostate cancer. And luckily, it was caught early due to early detection. But it could have been caught even earlier, but he was a caregiver. So he was so wrapped up in my mother that he even forgot about himself and his health for a couple of years. But luckily, it was caught early through early detection.
Talk about the choice that you made to forego that college scholarship to play volleyball and come be a caregiver very early on in life. Talk about what impact that experience, your mother's cancer diagnosis, and being thrust into that role of being a caregiver. What does that do uh, to your vision at that age in terms of the vision that you had for yourself maybe prior, and how that impacts, what you feel is possible, and how you see, life's path?
That's a great question. I think, when you're already in your early 20s, you're still trying to figure out what you're wanting to do. Some young adults already know, and some, like myself, were trying to figure that out. And I think with knowing that my mother was diagnosed, everything just stopped. I went to school to become a nurse, and that pathway and that career trajectory looked really different. And I think a lot of it was because at the time the need was focused on my mother, and so it I really didn't know. I didn't have a clear path. I just knew in the moment my mother was the priority. And I'm a believer. I believe in Jesus, and so I know in Scripture it says we're to honor our parents, and that was a way for me to honor my mother and my father during that time. And looking back on it now that I'm much older, I'm so thankful that I took that time to serve my mother and my father during the times where they needed it. It was no question. And so I think after my mother passed away, that's when I really had the time to not only begin to look at what I wanted to do professionally, but there was also another shift because I have this family history of cancer now. So
Mm,
I was trying to navigate my professional path as well as navigating my own personal health, having multiple breast cancers on my maternal side or my mother's side. So it was not only just my mother with metastatic breast cancer, it was her mother, which was my grandmother, and her grandmother, which was my great grandmother, all with um, breast cancer. So that multiple. And then now my father on my paternal side, he had prostate cancer. So my life looked different. And so, as I was beginning my career as a teacher, a health and PE teacher, I was also beginning I say, my personal health journey to protect my health.
at what point in time, then, knowing your family history, and that's a whole other story, because I grew up in a family and in a community where, Uncle Bubba just died. We we really don't know what happened. We knew he was sick, but we knew we lost weight, but something happened, and that was, at least in my story, right? That was very common, that uh, cancer was just a bad word. People just didn't say it or want to admit it. But what was that like? What, in terms of your family, knowing your family history, did people openly talk about it? Tell us about that.
So very similar. We didn't talk about it. I don't know if that's, a cultural thing. We didn't talk about it. I think we all know the saying, what happens in this home stays in this home, especially if you've been raised in a Black family.
Sure, right about that.
Don't go telling my business, So you hear that, right? And so I think a lot of it was, I think it was one, like, I think back to my great great grandmother, they probably just didn't even know what it was, right? I know when I was talking to my dad about it, it was cancer in the chest area. That's how it was really defined back then, right? And so I think a lot of it was just knowing or not knowing or having the full information. And then I think as the generations progressed, I think it was some information was shared, but not in its totality. But I'm so blessed. Both of my parents were educators, so they were really big on education, not just in school, but just in life lessons. And so that is really when it was, and it wasn't until after my mother passed away that I knew about her mother because my dad shared that with me. And so I'm so grateful that they shared that information with me, but that they were also as transparent as they could be with my mother's diagnosis. And by that, I mean, they never told me there wasn't a cure for metastatic breast cancer. And I'm so grateful and thankful because they wanted me to have this sense of hope.
Mm,
And they really wanted me to embrace every moment that I had with her. They knew I was in college, and I think having, knowing that there was no cure going into college, I don't know if I would have been able to finish college, right? So they gave me as much information as I needed. They left the door open for conversation, but for my family, they chose not to tell me that there was no cure, but they left the hope. And I'm so grateful for the hope that they left me, because I think it really helped me to, with where I was in life in college, continue to move forward with my college studies, and really be able to also support my mother.
I think that's a very strengthening, event to impress upon you. There's not an end date. Enjoy the moment and cherish and value one another. And I know you share your faith and your mother's story that when she was going through her care, she was actually doing some graduate work, and you saw her like thrive through that despite what was going on in her body. It certainly did not affect her mind and her drive to grow and be an example for you. Tell us about that.
Yeah. So as my mom was going through her treatment for metastatic breast cancer, she was also getting a whole doctorate degree in education. She was a,
Come
I
on, somebody.
know, I know. And and I lean on that today, and I will share shortly how. But she was a middle school, I'm sorry, an elementary school principal, um, going through a metastatic diagnosis, but still working on her doctoral degree in education. And, I didn't realize it then, but I always knew my mom was amazing. She was a superwoman. Like, how did she do it? Right. But now here I am. I'm 39 years old. I'm working on a doctoral degree. And it first came from seeing my mother being able to do that. I knew it was possible because my mother had accomplished that. And I'm a mom. My husband and I, we have two girls, and there are times it's hard. It is hard to have a full time career, and be in school. And then my first priority, which is my husband and my children, and to pursue this degree. But I think what keeps me balanced when it gets hard, when I want to give up, is knowing that my mother did this while fighting for her life, while battling this disease and going through this disease. And so it's inspiring to this day. But I knew I could do this only because I saw it from my mother, and I just hope to be that inspiration for my girls if they choose to pursue a doctoral degree, just for them to know that it can be done.
Absolutely. Absolutely. So you have this experience with your mother and your father as to being a caregiver. You do make it through college into young adulthood. At what point in time did you start to learn about genetics and the risk factors associated with hereditary cancer, and what led you to getting tested?
So, great question. And I will say this, and I didn't share. My mother was not asked about her family health history, nor was she offered genetic testing. Now,
Mm,
mind you, that was 2003. So that's not, it's, the conversation is not as mainstream as it is today, but it was available, right? And she should have been talked to. She should have been asked about. We know that there's disparities in the communication of genetic testing from provider to patient, especially in Black women, right? And so she was not asked about her family health history. She was not asked about genetic testing. And so that was a huge eye opener, right? And so when my mother was diagnosed and my father was diagnosed, I was just entering my early career as a health and PE teacher. So, health was something that was really important to me. I received my degree in community health when I graduated undergrad. And I, Rome, was scared because I literally just saw what was happening to my family. And I knew I didn't want to be next. And so it was the family aspect, right? But then it was also the provider aspect. I had a phenomenal OBGYN who's now retired, who always amplified and elevated the importance of family health history early on. So it has been something that was embedded in me from seeing my doctor annually. And she always told me if your family health history changes, because we know family health history can change at any time, and or if you find out new information, right? Because you could go to the family reunion and find out new family history. So she told me if anything changed or if you find out new information, call me immediately. Do not wait for your annual. And so that had always been instilled in me when I went to her offices. And so that's what I did. Um, After my mother passed, of course, going through the grief process and then my dad being diagnosed, I just had just some time to process. And I was like, I need to call my doctor. And so I reached out to my OBGYN. She brought me in, and that's when she talked to me about genetic testing, well, genetic counseling and genetic testing. And so I was, again, a young adult, like, what is this? What does all of this mean? And so I was very fortunate and blessed to be able to go through pre counseling and post counseling. And I know that's very rare, right? And so went through pre counseling. The genetic counselor really just explained to me what I was about to embark on, what this test was about. And then I went through testing. I found out, of course, I carried the BRCA2 mutation. And then I went through post counseling, which really helped me to know like my next steps. And while they didn't really push, a medical management on me, it was just, these are options, and, you can continue the conversation with your OBGYN. And so that's what I did. And that's when my OBGYN connected me with my high risk oncologist. And from there, life looked different.
I just want to pause there and just contrast the different provider experiences. And here on Genetics with Healthcare, we our mission is really to reach patients and their caregivers to close the gap between innovation that is amazing and that can save lives, prevent disease, and getting access to those things that can save lives and prevent disease. While your mother's experience with her provider, and this is no passing judgment, this is just saying what is here. In that instance, bracket testing had been out for about 7 years at that time. But in this instance, the provider didn't, as you mentioned, didn't even ask for your mother's family history. That is sounds pretty basic. This is stuff that you fill out on your paper when your intake paper to try to put in your chart. Okay, it's one thing for it to
Hmm.
be in the chart; it's another thing for somebody to act on it. But also, again, not passing judgment, but for whatever reason, that physician didn't mention bracket testing at that time versus the experience that you had with your doctor, very engaged, seemed to be in in it with you for your health care to say, hey, let's be proactive. Let's keep the conversation open. You don't have to schedule an appointment. Call me because we want to do something. Just two different experiences from a provider. And again, this is not a medical advice show, but we share stories of patients and advocates like yourself to help people understand, find a doctor that is willing to do what you want for your health, to ask you the questions. And we want to be able to give them the language and the confidence to go ask questions and engage their providers like that. But you just mentioned once you got hereditary cancer testing, the world looked different. Tell us what you found and how you acted upon that information.
Yeah. And so I want to go back really quick and touch on two things. I had a great doctor. My OBGYN was phenomenal. And I want to share this because it's important, but I am a Black woman. And for me, it is important that certain doctors on my medical team look like me. And one being my OBGYN, because I know that that's the doctor that is going to be with me as I go into becoming a mother. And so my maternal health was something that was important. And so having a Black doctor is something that is important to me. My OBGYN, my PCP, that is so important to me. But I also know that at the end of the day, I want the best of the best. And so my oncology team is not reflective um, of um, of how I, my of me being a Black woman, and that's okay. But I think what's important is when I was interviewing my oncology team, it was important that they saw me as a Black woman. They understood that that was a critical factor in the urgency and in the individualized care that I needed, in addition to my family health history and my genetic predisposition. Those were critical. And so while I have a very diverse medical team all around, the key driver is two things. They understand that I am a Black woman. They understand the disparities, not just in breast cancer, but in all disease states that are linked to people of color, to Black women. And then, second, they understand my genetic predisposition. Those are the two requirements. I don't care how you look, as long as you are the best, and as long as you know those two factors and how they play into the care and the attention that you give me, we're on the same page.
Absolutely.
And so when I go and I look for doctors, I look for that because I need you to understand all of those factors, right? And so, with now going into your question, you know, it began looking different very quickly because I began to see my high risk oncologist, and she began to share with me all of my medical management options. And at that time, and I know we've made some advancements since then, it was early initiation to screening. So at the time, I was 21. And so it was beginning my mammograms and breast ultrasounds and breast MRIs early. We also talked about hormone therapy, or chemo prevention now, which is it's called. And then we also talked about prophylactic or preventative procedures to drastically reduce my risk. And so we talked about the three of those. And at the time, unmarried, young, I was a teacher. I didn't want to do anything as invasive as a mastectomy at the time. I also did not want to begin any hormone therapy. I think a lot of my decision of not going that route was still grieving my mother and going through that process. And a lot of the hormone therapy options that they offered me were therapies or were treatments that my mother was offered, and so it was a trigger for me. Not necessarily on the drug; it was just a trigger, right? An emotional trigger. And so I elected just to begin early initiation to screening. And I did that for over a decade. Had my first baseline mammogram at the age of 21. And every 6 months, rotationally, I had breast MRIs and breast ultrasounds. I also had dense breast tissue, which we know is you are at an increased risk when you have dense breast tissue. So I had dense breast tissue. I had a known BRCA2 mutation, and so those different modalities in screening really helped me to feel confident and empowered that I was taking control of my health. And I knew that if should something occur, if that onset of disease should occur, that me and my medical team, we would catch it early.
So you had this experience early in life, and then to this point, it ended up shaping your path professionally. Tell us about the work you do at Living Beyond Breast Cancer and the work you guys seek to do to help patients and their families.
Yes. So, my origin story really informed my professional career, my professional path. And I'll touch on living beyond breast cancer, but I really want to share how, I started my career as a health and PE teacher. And from there, um, I was so intrigued about the information and the knowledge I was teaching my students. And I realized that the books and the curriculum really didn't change, right? While the world and the medical and the advancements were changing around us, the textbooks were staying the same. And so I remember being and joining the curriculum writing team to make sure that these textbooks and the information were updated and reflective of the real world. And so that really led me and was a springboard for me to go and pursue my master's degree in public health, which when I tell you that just opened up a whole nother world of how you have to integrate public health into the medicine. You have to integrate the environment in which people live into the medicine. I was sold, right? And so I got my master's in public health. I was able to do some I was able to transition my career where I worked in healthcare, and I really saw the impact of the burden of disease, diabetes, cancer from a claims perspective, right? And really
Mm.
seeing the impact that it has on healthcare. And then from there, I transitioned to the county public health department, where if you want to get into the meat and potatoes of public health, you got to go to the local county public health department because you're going to learn everything. And that's really where I fell in love with equity and policy. And so, just as I progressed through my professional career, I was also I began my advocacy career, in which I've been in almost I've been in this advocacy career for almost 2 decades, right? Being a starting off as a speaker and sharing my voice, which is so important, and then
That's amazing.
really it is, and then going through these different trainings where I'm being trained as an advocate and learning more about um, the area that's really important to me. I then merged my professional path and my purposeful path where I entered into the nonprofit space. And I've been able to work at organizations like Susan G. Komen, where I was able to lead the African American Health Equity Initiative in the Houston and the DC area. I then transitioned to the American Cancer Society, where I was and served as the inaugural director for the National Breast Cancer Roundtable, which was an initiative that came out of the White House under the Biden administration in collaboration with ACS, and the great work that they do around their roundtables around the different cancer disease states. And then from there, that really motivated me to pursue my doctoral degree in breast cancer disparities, really focused on epigenetics, right, and how stress and how race things like racism and the allostatic load really play a part in help. No, not help. I'm taking. Let me go back. How the allostatic load and how those things and how those stressors really impact our health and our health outcomes, right? And what I learned while I was at ACS was that I wanted to continue to grow in my career, but I found myself one step away from community, right? I was really missing the closeness of community. And I had always told myself in my career path, if I get too far away from the people of community, because I was a teacher, so I'm close. I'm used to the close knit connections, that I would always course correct. And so I found this great opportunity at Living Beyond Breast Cancer, for the vice president of mission delivery, and knowing our mission of providing trusted health information in communities of support. While it was so hard to leave ACS, it was something that I was needing to do for myself. And at LBBC, um, we have a phenomenal team, and we have a great community. We also do great work in the metastatic breast cancer space, offering trusted information. And for me, that was important because my mother had metastatic breast cancer. So I'm super excited to be working with a phenomenal organization that's continuing to serve our communities.
I think it's amazing that your experience in life set you on a very purpose driven path professionally. And as you mentioned, that snapshot of your mother, watching your mother study for her PhD. Now your daughters are watching you do work to achieve your PhD. And I think it's interesting. You mentioned before the disparities, not just
Mhm.
in breast cancer or cancer in general, but cardiovascular disease, diabetes that affect uh, Black Americans. This includes social determinants of health, which is
Mhm.
understanding the effects that the community that you live in, how they have an effect on our well being and how they may impact our genetic risk to develop disease. Why is this type of data important for someone who's not in the medical field? Because we may have heard of disparities, but this person who might be listening to our conversation, what are social determinants of health, and why is that important for someone who's not in medicine to know?
That's a great question. And as a public health practitioner, as a public health professional, we know that we have to go into the places where people live, work, worship, play, and it's so important, right? Because that's the environment that people live in, and it's important to them, right? And so when you think about the social determinants of health, and the social determinants of health, for example, are things like income, education, housing, neighborhood, safety, healthcare access, systematic racism. They are deeply tied to health outcomes. They shape not just whether someone sees a doctor, but whether they're offered the same information, testing, and care as someone else. For Black women, structural inequities can limit access in timely screening, cultural sensitivity for genetic testing and counseling, and preventative measures as well. I touched on earlier really looking at the epigenetics, but things like the biological impact. So, the chronic exposure to social stressors can change the ways that genes are expressed. And this is where epigenetics comes in. And so, this is something as a doctoral student that I am continuing the research from those that have come before me and those that are currently doing this research to really understand how these environmental conditions can alter our gene activity, right? And so, one book that I love is a book called Weathering, and it's by Dr. Geronimus, who really describes the cumulative toll that chronic stress um, can play on the body. And so it's not just about genes, it's about how the world around you activates or silences those genes, right? So I think it's important for people to understand what the social determinants of health are. And when we talk about precision medicine and individualized medicine, you can't have that conversation without including the social determinants of health. Because if you really want to understand the standard of care for a person, you have to take into account their transportation. Are they able to get to treatment?
Come
Maybe they
on.
live in a rural community. Maybe a comprehensive cancer center is 2 hours away,
That's
right?
real.
And maybe you also have to look at childcare. While children are not a barrier, they are a blessing. But we know we can't always take children to appointments. So being able to have a reliable childcare so that you can get to those appointments, they're huge. I think another thing is also understanding not only with uh, healthcare access, it's understanding how to be able how to navigate our health care. I know when I was going through my medical management and even my double mastectomy, I had to be an advocate to my health insurance. There were things that they did not know, so I had to equip myself with the policies and the legislation.
That is
um,
huge. That
it
is
is
so huge. Okay, I'm sorry. I didn't
it
mean to- Please say that again.
is.
I
No,
mean,
you're good, because what I realized is sometimes you're calling your health insurance and they're reading from a prompt. They're reading
ugh,
from the screen. If the patient says this, you
ugh,
say that, right? And
ugh.
I had to really advocate for myself. And it goes back to having great doctors, because my doctors, when I needed, and this is one example, I remember when I had my mastectomy, I had it in December. And that following March, my employer switched insurance companies. And so when I went in for reconstruction a couple of months later in early 2017, my doctor, reconstruction doctor who had started my surgery, was no longer in network. And so my insurance told me you need to go to three other doctors within network. And I went to three doctors, and all of them said, you're technically still under the knife. We will not touch you because technically, your mastectomy is still in progress, right? So insurance made me get three denial letters from those in network doctors. And then I had to go back and get a note from my recon doctor that stated that my patient is still in active surgery in a sense. Um, and then once I got those letters, insurance finally approved my reconstruction doctor at the in network rate, right? But it was an emotional journey. It was back and forth. I just had a mastectomy. I did not have the energy to go
Yeah.
back and forth. And so you have to be an advocate. You have to educate the health and the insurers. And you have to. It's
Yes.
critical.
And the reason why, well, and if you've been a patient, even if you're going to the dentist, sometimes you got to advocate to get your cleaning paid for. But here's the reality, and you know this, and we'll post some links on the episode page to take you to these studies. We're talking about we're talking about breast cancer disparities for Black women, and the potential that precision medicine has to eliminate or at least level the playing field. But the first things first, studies show that Black women receive standard of care less often than white women with breast cancer. What actions can be taken? Number one, at the healthcare system, and then secondly, by patients and their family members who might be listening to this. What actions can be taken, um, whether they're affected with disease or unaffected, to level the trajectory of these disparate outcomes with breast cancer?
That's a good question. And I would say if you asked me this before I started my doctoral program, I would have said one thing. But now that I've been in my doctoral program, it has challenged me, right, to see things differently. And so I'll say a couple of things. I think it's important we have to at the health systems level, we have to integrate screening for social determinants of health into clinical care,
That's a
right?
fantastic idea. Absolutely.
With my health system, anytime I go into Epic and I go to my chart, I think annually there's a social determinants of health survey. They're asking about my transportation, they're asking about my child care, they're asking if I live in a safe environment, a safe physical environment. They're asking and screening for those things, which I think is critical. And I know that um, that my responses to that survey are in my chart, that my doctors see those things. I think that's one thing that's critically important. I think offering genetic counseling and testing equitably, especially in high risk and underserved populations. I know genetic counseling might be a little bit harder because unfortunately we don't have a genetic counselor in every office and every health system. But I think it's important for providers to have continuing ed just around the importance of genetic testing and screening so that they're able to provide information to their patients and being able then to be able to provide them with trusted and credible information to continue the learning. I think it's also important for providers to be trained in trauma informed and culturally competent care. I think
Mm.
that's something that's really important. Um, I think with that, I heard this scenario and it was very impactful. If you have a doctor who is talking to a patient and let's say the patient is a Black woman, right? And the doctor is asking, um, are you taking your medication? And the patient may say, I'm not. That doctor would probably go and say, okay, patient is not compliant. No, patient's not compliant. You just didn't ask the right questions. Right questions would be, when was the last time you took your medication? And maybe that answer was 2 weeks ago. Okay, so clearly they're up to date. They're not compliant or they're not taking their medication. So what's happened 2 weeks ago that has caused you to not be taking your medication as of today? Maybe you'll hear transportation as a factor. Maybe they lost their car. Maybe they lost their job. Maybe they're not able to get to the pharmacy. Maybe there's been financial strains and they're no longer able to afford the medication. Is there a genetic, not genetic, is there a generic, I'm sorry, is there a generic alternative that's cheaper, right? How could you change the treatment algorithm to help to, continue the treatment or continue what's needed medically, but also accommodating the needs of the patient. And so I think it's understanding the depths, right, of when you're asking your patients questions, the why behind it, instead of assuming in compliance. So I think that's important, right? I think supporting research that includes racially and social, economically diverse populations to close those data gaps are important. And then finally, for health systems, I would say address the biological impact of chronic stress through holistic and preventative health models. I think that's key. I know in the cancer space, palliative care is not talked about enough, and it is so
Yeah,
important. That should be offered at the beginning, but I also think there's a stigma around it that it's hospice, and it's not. Palliative care can be offered from the moment someone's diagnosed.
that is so rich. And I don't know if you speak from the platform or the podium about that. I don't know. We were just talking 3 4 minutes, but that is so valuable to get into the healthcare management space. So hospital CEOs and executive directors, hear that. I think that is phenomenal.
Absolutely. It takes everyone. It does. And we have to look and see where we can make those changes and those shifts in practices and policies and procedures, to be able to ensure that we're doing things in an equitable way, um, and even knowing that it's truly individualized. And if you really want to treat and support patients, you have to be able to ask the questions that go beyond the medicine, right? That go beyond the DNA, and that's their environment. And that's also,
Yeah.
and as I shared, I'm really huge on my faith. Faith is huge, right? People believe in different things, but you have to understand that faith goes a part of understanding how to care for the total patient, because depending on a person's faith and beliefs, that's really going to be a huge factor in decision making, right?
Yes.
So I think it's being compassionate and being open to those factors that go into decision making, and those factors that also could be a hindrance to decision making as well.
Yeah. We were talking before we went live with the podcast, and I'm a girl dad. I have 2 daughters. I know you have 2 daughters. And so I would tell you the very second that my first daughter, Marlo, was born and she opened her eyes, for me, the world became a much darker and dangerous place. Right. And we talked about, so you just talked about educating clinicians on just trauma or cultural competence, and I can't say it quite as eloquently and informative as you did, but one of the important things that wasn't necessarily a resource when your mother was diagnosed with breast cancer is you are not only talking about it, you're doing the work, you're creating the tools that can help alleviate the trauma associated with disease. You are an author.
I am.
Arthur, you are an author of 3 children's books. Is it three?
So it will be three. I'm working on my third, but one I've republished twice. So
Okay.
it's technically three, and then a fourth one on the way.
Well, then it's three. Tell us about those books, because I think they're phenomenal resources for people out there to know where they are and know where to get them. What inspired you to write those books?
So what inspired me was my personal experience and the gap in the resources. And as I shared earlier, I began my career as a health and PE teacher. And as I was going through my preventative double mastectomy, my oldest at the time was about 10 months old, and I found myself without the words of explaining to her why mommy couldn't pick her up, why she couldn't lay on mommy, why mommy just couldn't do certain things. And so I went online to try to find a book, and I knew that if I were to find a resource, it would be a resource that was linked to a cancer, right? Because typically you would find books around mastectomies when a woman has been diagnosed. I was not expecting to find a book about a undiagnosed woman having a mastectomy. So I even went to go look. I went to go look for those books, and I found a couple, but I did not find a book that at the time that reflect either a Black woman or women of color. And this was very disturbing for me because it was so important that my children see themselves reflected in books. And so I decided to write The Big Discovery, which is a tool to help all families have a conversation around a breast cancer diagnosis. And at the time, I decided to write the book with um, characters that reflect people of color. I can honestly say at the time, I wasn't as bold as I am in my advocacy as I was then. So I was very nervous about how a book with Black characters would be received. And so I was safe. I created characters that, again, were characters that were really any person could see themselves reflected, which I'm glad that I did. Um, but what I did in 2021, God laid it on my heart to republish my book with Black characters. And I knew I needed to be true to myself. And so I republished the book in 2021. And this time, like I said, I was more bold and more confident in my advocacy. And for me, it was important to not only create a book with Black characters, but to find an illustrator who could skillfully depict Black characters in a culturally unique way, which was amazing because my illustrator is not a person of color, but they have such an amazing eye for detail. And so I was super excited to work with her. So I relaunched in 2023, and this was to bridge the information gap and offer a culturally relevant resource to empower Black families and all families facing a breast cancer diagnosis. We have to acknowledge the disparities in breast cancer outcomes, especially for Black women who are at 41% more likely to die from this disease. And I believe that having tailored resources can empower families and communities to navigate this challenge together. Um, all of my books the forwards are written by doctors. So The Big Discovery is written by the forward was written by a surgical oncologist, my oncologist. And it also includes stories of Black mothers who've been diagnosed with breast cancer. It includes conversation starters, medically accurate images of breast screenings,
Mm.
um,
All for
Black,
kids.
all for kids, right? Because, Rome, what's going to happen is sometimes kids may or may not go to those appointments, but they're going to hear the words mammogram. They're going to hear the words malignant. They're going to hear these terms. And what I really wanted to do was to provide them with a child centric image and story to help them make the connections, right? And so my book features Black doctors because we know representation matters. It reflects Black navigators, patient navigators, Black genetic counselors, and other Black healthcare professionals. It also provides hand on activities so that families can have the conversation. So that's the big discovery. And then the big family trip, which I launched in October of last year, focuses on how to have family health conversations around a family health history, right? And so it takes place at a family reunion because that's typically where the time the entire family gets together. And we know in the Black community that family reunion is a staple for our community where we get together and we can hang out and just connect. And so that story talks about their kids and their parents are going to their mom's family reunion, and what they decided was that year they were going to have a set aside some time at the family reunion to sit down and talk about family health history, and have an activity where people who chose to participate could participate, and really empower the family to take this information back to their doctors, so that it could be able to help inform medical decisions. And so finally, I'll say, it was important for me to do this also because of the importance of not only representation, and discussing health topics, but also it's important because children who identify as Black, Indigenous, and people of color often encounter gaps in literacy. According to Our Kids Read, only 18% of Black children read on grade level. The Children's Book Council statistics indicate that only 13% of books feature Black characters. And so, for me, by providing educational resources that feature characters and professions that reflect the identities, and addressing these health topics, really can empower them and their families to engage in conversations more confidently.
So good. Thank you for sharing this on our podcast. This is so good. Okay, where do they get the books?
So my books are available on Amazon. They are also available on barnesandnobles.com. And those are the two places where you can find them. And yeah,
We'll share those links to those books on genetics for healthcare here on the podcast episode and all our social media links as well. Um, Ashley, we do this to empower patients, to give them the language, to give them the confidence to be an advocate for themselves. Because as you just mentioned, you get tired, right, fighting disease. In addition to all the things that a mother, a woman, a father, a son has to do, the responsibilities. So we like to give our listeners practical tips that they can share with their providers or their family members. These can be questions, resources, whatever. But what are three practical tips that you can give our listeners to help them advocate for hereditary cancer testing?
absolutely. I think the first thing, advocacy begins at home. I think it's having the open conversations. We can no longer live in the time where keep our business, what happens at home stays at home, keep our business private. Yes, some information definitely should be kept within the household, but information around family health history and diseases and conditions, that information should be shared.
I've shared it. Yeah.
Um, we have to, and it's not a one-time conversation, it's an ongoing conversation. And it's not just cancer, it's diabetes, it's heart disease, all of mental health conditions that can run in families. I think that's important. That's where advocacy begins. And as a mother, the best information that I can give my children is their knowledge on their family health history. Rome, my genetic results are in my will. If I die
Mm,
today, my children are young, but that information is written into my will because I don't need an additional barrier for them as they go into the healthcare system, right? They're already Black women. I need them to know this genetic predisposition that I have and have it documented so that when they enter into the healthcare system as young women, they have their mother's results. That's the greatest gift that I can give them as it pertains to their health, right? I think
wow.
another factor is, um, we have to not only talk about these conditions, but remove the stigmas around these different conditions, right? I think it's important to create a space where people can, when we're talking about family health history, where they can talk openly about mental health conditions and other conditions in a safe environment and not feel shamed, or any less than because they have, or they're sharing this information. So I think it's talking about it. I think it's creating a safe space for them to talk about family health history. And then I think, and none of those that costs nothing, right? I want to acknowledge that, um, that as a woman in this space, that there's certain access and privileges that I've been able and blessed to have, but those things cost nothing, right? And I think the last thing is our voice. Another thing that costs nothing is our voice. It's being able to, if you feel something is wrong or it's off, stand up, say something. If you go to the doctor and you don't receive equitable care, you don't receive just the decency of being identified as a human being and being treated as such, before you leave, you need to go to the administrative offices and file a complaint if something has been done to the point where it warrants that, right? Because what we can't do is continue to allow um, persons to be mistreated, regardless of how they identify, what they look like. Every person, regardless of of their ability, disability status, their gender identity, their sexual orientation, their diagnosis, their zip code, their income, every person deserves equitable, individualized care. And if you are receiving less than that, you need to say something. So those would be the three things that I would say. They cost nothing. And our voice is so powerful. I've had to use my voice so many times. That's why I speak truth to power. That's why I'm bold. That's why I'm confident in what I do, because our voice has power.
Your voice costs you nothing, but its value and its power is immeasurable.
Absolutely.
Ashley, I feel
Absolutely.
energized. I really do. You know what I'm saying? I do. Ashley Dedmon. Uh, Ashley Dedmon, BRCA2 carrier, breast cancer previvor, and a warrior for justice and equity in healthcare. Thank you for being a guest on Genetics for Healthcare.
Thank you for having me. I've loved this conversation. Thank you for creating this platform to have these conversations. I'm learning so much from your podcast, and I can't wait to continue to learn from all your future guests.
Blessings. Thank you so much.
Absolutely.